So for discharge planning needs, this is a patient that is well versed in these episodes. He has been dealing with this for many, many years now. Usually people are diagnosed in their toddlerhood, and now he's 19. So we need to take that into consideration that this is not his first hospitalization. And then that can help us to further assess his needs and create those discharge plans. So a huge part of discharge planning is the teaching that we provide. So a lot of times the best way to do that is with brochures and pamphlets and pictures, because people are usually more interested in visual things like that. So like I said before, this is not his first hospitalization, so we need to assess his understanding. It's probably safe to assume that he knows the basic symptoms of the crisis and the causes of it, but we should reiterate this. So some of the possible causes, and I actually listed them in the speaker notes below, but I'll go over them. Consumption of alcohol. This is interesting to know with the age of the patient. Since he's 19 and not 21 yet, he may not want to talk about drinking alcohol because he's underage. So just creating that trusting relationship with him is important as a nurse. Smoking can be a possible cause. Dehydration, stress, infection of any kind, so a cold or a virus, strep throat, anything like that. And then stress on the body from like swimming in cold water or cold temperatures. And then also, since this patient is on a new pain management plan, it's important to talk about the side effects of medication. Since he's on morphine and gabapentin now, those are narcotics, so, or at least the morphine is a narcotic, so we need to talk about bowel hygiene and the importance of that. And then also some alternative methods to pain management, such as massage, heat therapy, a warm bath, stuff like that. So there's, I looked it up actually in San Diego. There's a lot of different support groups for sickle cell anemia. And one of them is the American Sickle Cell Anemia Association. And in the speaker notes below, I posted their website and their contact number. This is something nice to give to your patients if they're, you know, it's always better to have someone that totally understands what you're going through. Another source or support group is the Sickle Cell Disease Association of America and the San Diego chapter. I have the address, the phone number, and then the email again in that. And there's a quote from there that I really, really like. It says, "It's important for you to have a positive attitude, create a supportive environment, and develop coping skills to help you deal with your disease. Strong family relationships and close personal friends can be helpful. A support group might help you cope with your disease." And so I think that's really true. A support group is nice because it's people that understand what you're going through and have the same maybe issues that you're facing. Home care, the patient might go home with follow-up from an RN, physical therapy, occupational therapy, if it's affected his functional status in any way. And then maybe discussing wearing a medical alert bracelet, which is important for anyone that has a chronic disease. As for placement, case management helps us a lot with this. And really, I mean, I think the basics of it is what is best for the patient's health. Currently, he's living with his mother and two sisters, and that is a great situation because he's around people that know him, that know to his disease. Since he is 19, going to community college, maybe there's a time that he wants to move out and live with a roommate or go to college. It's important to discuss this as he makes that decision and talk about the importance of having someone with him. So if he does have these crises again or a crisis event, that he can have someone to help him. And then also discussing, a lot of colleges have on-campus health services, so allowing him to have resources for that, and then discussing that is a good option as well for him.